This has kind of been a neat opportunity to write a new talk about a relatively new topic. How did the pandemic affect surgical education, and kind of where are we trying to go from here? I submit it's going to represent a neat opportunity for those of us, especially in academics and education, to kind of pivot a little bit from some habits and some ways of doing things that have just been baked in for forever. I have no COI. So contextually, if you think about where medical education has been over the last couple hundred years, going back 40, 50 years, maybe before most of us in this room's time, we had guys like Halstead in the middle there and Starzl down below. And they were probably not fun individuals, and they were probably not balanced individuals. And their idea of wellness, certainly in the case of Halstead, amounted to doing a ton of heroin and disappearing for a few years and then showing back up again. And I think we would all agree that that's not the current definition of wellness. The medical education contract, how residency and those that got to learn healthcare was performed, is just very different back then. The third picture there, the black and white to the left, I don't know if anybody recognizes that. I was hoping Ted Ning would be here, but I think he's not. That's Jack Grayhack. Dr. Donahue probably knows him from back when. He was the chairman at Northwestern for a very long time. And he was an amazingly inspirational and talented figure. I was fortunate to cross paths with him there after he had retired, but was still around. But he also, that guy didn't do much but medicine, edited the Journal of Urology for like 16 years or something. He was an amazing, inspirational character. But those were different times than they are now. And even in the last 10 or 20 years, residency has been changing quite a bit. The ACGME came in 2003 and brought the work hours rule in. And I think that has created an environment where residents now work in many ways harder and less joyfully than what we did back in the day. We didn't go home much, but we knew the patients, and there weren't that many. And they came in for a long time. We saw them every day. And we worked a lot, and a lot of things happened, but I think it was very different than the data management morass that exists now. Current estimates are that for many residents, and this is not necessarily just surgically, that for every hour spent in patient contact, like actually doing medicine, 2 hours are spent doing data entry and all the stuff that comes with it. And that I just don't think is so much fun. I'm a VA practitioner, and I spend way more time in front of EMR and CPRS and whatever than I'd like to. And it, for I think all of us, makes us want to beat our head against the wall. Residency administrative tasks are high. The contract of education, and I feel that the ACGME kind of drove this a bit, has changed such that residents used to show up and say, my life is yours, I'll go home when you tell me I can, and it's a pleasure and a privilege to be here and learn this. And now it's this sort of 80-hour work week, like it's time for me to go home and get my wellness on. I think it's for the better overall, but things have definitely changed. And the expectations of training have gone from this is an amazing opportunity to sit at the feet of the greats and learn how to do this thing to, teach me and tell me how to do all this. Again, not necessarily bad. It's just different, and it kind of is what it is. This is the picture of one of our absolute best residents. This guy got the highest in-service score in America. But this is how residency goes these days. It's just a lot of time in front of the computer doing these things. So the pandemic has changed things additionally, and on top of that, it forced everybody out of the hospital that didn't have to be there. It forced us out of the operating rooms in urology quite a bit, as we all know. And that varied by institution and by state and by month and by year. From the educational side of things, simulation got talked about a lot, got pushed a bit more as just a way to fill time. Hard to know what the future of simulation is, but it definitely saw a bump in curiosity and popularity. I did fellowship with Ahmed Ghazi, who's down at Hopkins now, really famous guy in the simulation world, and he's done amazing work with it. Virtual, we all have spent more time in front of Zoom or Teams or WebEx or whatever it may be than we can even stand to talk about. And that's been a challenge. I think we're all kind of glad to see that go away for the most part. But it's tough. It's nice to go downstairs in the early morning in your fluffy slippers, get a cup of coffee, and not have to put on anything more than gym shorts. I do go that far personally, but the Zooms have just really been a thing, and engagement and learning and education from a virtual format, I submit, has been greatly less and substantially diminished from in person. Telehealth exploded for everybody, and not too much to talk about there. Our academic offices, the work from home thing, like there's nobody there. It's amazing. You walk around the fifth floor at A01 at Anschutz, there's no one there. It's remarkable. We're starting to have discussions to talk about trying to bring some of the staff back just a little bit, just to justify the space. And the final thing has been this great increased focus on wellness. Wellness, ever since the concept of burnout developed in sort of the late 90s, and that largely can be traced to some of the governmental choices in terms of documentation, the EHR, EMR, Advent, all the virtual sort of things that I kind of talked about. They are not associated with any of us being particularly happy, and that's its own set of talks and topics there. But wellness and happiness has become a really big focus. And this happened not just in healthcare, but also beyond healthcare in terms of what was called the Great Resignation. This was just a global phenomena that many of us and everybody else seemingly in the world woke up and said, wow, my job absolutely sucks. And sitting in traffic to get to work is painful. And why am I doing this? And why don't I live in the mountains more? And why don't I work from home? And why don't I have more time with my family and my kids? And a lot of people just took a step back and have thought about it, reevaluated their jobs, their values, their priorities. In healthcare, this is arguably even more accelerated because of the fear that all providers had at whatever points in the pandemic that you were going to catch this disease and get very, very sick or die, which did to some of our compatriots occur, unfortunately. Pushing in a bad direction, the financial pressure that hospital systems felt also just made everything a lot worse. So that's kind of the where we've been, and then talking a little bit about where we go from here. Yeah, on simple high levels, telehealth undoubtedly has some future. I think that's still being worked out by both the insurers and the practitioners. Simulation, it'll show you how to drive the robot. It'll show you how to tie a knot. It is very unclear to me that it has still met its promise of showing residents and trainees, and all of us for that matter, really how to operate. It takes a ton of time to do. And when you got 80 hours in a week, if you're dedicating a lot of it to sitting in a little room, popping imaginary balloons with your hands in the air, it's unclear what value that has. But what we can do right now is refocus a bit more on these topics, the topics of wellness, health balance, burnout, happiness. We've all stepped back and thought a bit about that, and I think we're happy to be back at work, but these still remain live topics and very live topics in surgical education. National curricula resources, a lot of places have used this opportunity to develop these big sets. Dr. Flynn has a ton of educational videos that people can watch and see and learn how to do things. But the number one place of where we go from here for us, very excitingly, starting in just a week or two, is back in person to Grand Rounds. We're wildly happy to get back. At the end of the day, we're humans, and we're animals that like to be together like this in rooms, and it's exciting to get back there. The pause for thought that the pandemic has created has, though, been a real opportunity to stop and think about how we teach, how we train, how we motivate, and where we're trying to go. A time to really think about, at the student level and at the trainee level, what our values are. So the things that we've been chasing for a very long time, grades, just looking at medical students and college students in elementary school, are counterproductive. There's bushels of research on this showing that grades make nothing better. If you do well in your grades, the only thing you want to get is more grades. If you do poorly in your grades, you just don't want to go to school anymore. And in neither direction do grades accelerate anything. And they change the metric that you're pursuing from curiosity and education and learning and cool things over to, I got to get good grades. I just got to do whatever I'm told. So this represents a bit of an opportunity for us to hopefully shift away from that. Metrics, I would submit for all of us on the work side of things. Chasing RVUs, I don't know if that's a particularly good metric. A lot of people do it. Not sure it makes perfect sense. Not to say you don't have to keep the lights on, but to kind of pause and think a little bit more about it is a thing. And undoubtedly, these somewhat historical patterns have resulted in business driving what we do and leaving patients that are much less happy with the care that they receive than they were just 5 or 10 or 15 years ago. So at the end of the day, again, educationally, this is really a chance to realign with curiosity and with joy and with the things that make students and children and young adults want to go into medicine. Medicine and surgery is an unbelievably cool opportunity to do really neat things for people and to help them realize that they're not there just to get more A's and do really well and to get a good job, but to do something that transcends those metrics is the goal that we're trying to pursue, and that I think can, at this opportunity, be realigned with in medical education. It's kind of an opportunity for all of us to kind of step back and remember, like, why did we sign up for the jobs we have? Why did we sign up for academic jobs or private jobs? These are opportunities to do lots of great things and to sort of realign how we think of the metrics that we all pursue. This is the obligatory ChatGPT generated vision of the future that we can all get to. I thank you all very much for listening, and tonight is the CU football opener, so go Buffs.